So good afternoon, everybody, and welcome to our second Achieving Person-Centered Practice Masterclass. So today, this is a collaboration with Southeastern Sydney Local Health District and our friends Illawarra Shoalhaven Local Health District. So hello to both districts that are on today. My name's Susie Murray, and I'm from the district, Southeastern Sydney Local Health District Nursing, Midwifery, Practice and Workforce Unit. And I'd like to begin by acknowledging the traditional custodians of this beautiful land that we're on today. I'm on Darawal land here at Sutherland and pay respects to elders past, present and future, and any Aboriginal colleagues with us today. Thank you. So we're so excited to be able to introduce our international guest speaker for today, Professor Kim Manley. So I've got a short bio here, and I say short, we've made it short so we can, most of this time can be with Kim, because it's a long one, Kim. Kim is Professor of Practice Development and Co-Director of Impact Research Group at the University of East Anglia in Norwich in the UK, and Emeritus Professor of Canterbury Christ Church University in the UK. So Kim integrates research and scholarly inquiry and practice development, workplace learning and leadership development to develop and sustain effective workplace cultures that are person-centered, safe, effective and good places to work. So in 2000, she was awarded the CBE for Quality Patient Services. In 2015, identified as one of the Nursing Times top 50 leaders, and in 2018 recognised as one of 70 nurses having most impact on the National Health Service since its inception in the NHS 70 years celebration. So wow. She's currently leads the development of a multi-professional consultancy capability and impact framework for health education in England, aligning to advanced practice and systems leadership. Kim's got over 165 publications, 6 edited books, and has examined many doctoral studies internationally. So welcome, Kim. And today's masterclass is titled Guiding Lights of Effective Workplace Cultures. And I'm going to hand over to Kim. We'll have, opportunity for questions at the end, won't we, Kim? So thanks so much.
Thank you. Thank you, Susie and Barb, for inviting me to speak. It's a real privilege to connect with all colleagues who are participating today. And some of what I'm going to be talking about is covered in the conference, but I'm taking a slightly different slant with this masterclass. I will start in a moment with providing an overview of the journey of getting to these guiding lights of effective workplace culture. And then I want to revisit some of the key landmarks to explain in a little bit more depth about them, and then explore the insights about each guiding light. There are 4 of them. At the end, there are references, and so you're welcome to have this presentation and the references to go with it and share that with colleagues. That's no problem at all. And I would encourage you, if you have any comments or questions for clarification, to put into the chat, because Susie and Barb are going to keep an eye on that for me, and we can pick that up at the end. And if we don't have time, I'm sure we can manage another way of exploring some of the dialogue with you. So to start off with, then, I'm going to start with an overview of the journey to get to developing these guiding lights. Could I check out that everybody can hear me and see the presentation okay, please?
Yep.
So, So the journey started really quite a long time ago now. So my interest in culture, I shall explain tomorrow in my keynote, but I undertook some action research for over 3 years to operationalize the consultant nurse role in a critical care unit and nursing development unit. And part of that research really looked at the processes needed and the outcomes to achieve what I called then a transformational culture, one that was person-centered, one that enabled people to grow and flourish. Then the next development really happened when working at the Royal College of Nursing, we established with colleagues an international practice development colloquium to study some of the concepts that were core to the concept of practice development. And these concepts were things like flourishing, facilitation, culture, person-centeredness. And then depending on our interests, we joined a group and began to explore theoretically what these concepts looked like. And I was particularly keen to be in the workplace culture concept. So worked with colleagues over a long period of time to review the literature. It was about nearly 8 years between the publication and the starting journey. We reviewed the literature to try and understand what an effective workplace culture looked like. And we published that in the International Practice Development Journal in 2011. And I'll be coming back to these key points. Then also in 2011, I worked with colleagues in Australia, Cheryl Moss and Jackie Cross, because we wanted to position effective workplace cultures as the proxy for achieving health outcomes that were quality outcomes. So if you had an effective workplace culture, according to the concept analysis, then that would almost enable the health outcomes that we all want to achieve that are really complex to be achieved. And then subsequently after that, over a period of time, in my joint clinical chair with the NHS, I set up with colleagues what was called the ACER initiative. It stands for Achieving and Celebrating Excellence. So we used what we'd learned about effective workplace cultures to enable leaders who had undertaken an integrated leadership program to work with their teams to collect a portfolio of evidence to show that they were effective workplace cultures. And then after that, a few years after that, I got involved in a big project looking at safety culture. And we looked at 4 acute hospitals in the southeast of England and 10 teams. And that led us to revise our thinking about how you develop effective workplace cultures and how that linked to safety and embedding safety culture. So we had some sort of improvements in our understanding, which I will talk about too in a moment. Then in 2019, a project with my colleagues around the UK, we had funding to explore the question how to strengthen the leadership role of nurses, midwives and allied health professions. And we did a massive study with that and workshops around the UK and generated what we called the guiding lights of leadership. And although the publication has only recently come out, it informed our next piece of work on effective workplace cultures. And that's where the guiding lights term came from. And I will explain that as well in a moment. So the guiding lights of effective culture have been taken up very positively within England. So the NHS are taking forward a programme that's facilitated between the Foundation of Nursing Studies and UEA with clinical teams, nursing teams, to look at how they develop effective workplace cultures and how to recognise them. And then more recently within the Eastern region, which is a little mini version of one of your states in England, we've developed a transformation academy because we know that we have to transform our workforce to enable them to provide an integrated service to our citizens and populations. And one of the communities of practice that we've set up is around effective workplace cultures. And I share that with you because it's open to anybody and everybody if you're interested in joining. Okay, so that's the overview. And as I mentioned, I'm going to come back to some of these areas in a little bit more depth. So the first concept I mentioned was a transformational culture. And I just coined this term mainly because of its link with being adaptable and flexible, and defined it as changing in its form and disposition, readily adapting and responding to a changing context, but based on fundamental core values that in turn enable individuals to develop their own potential and their practice too. And such a culture was defined as nurturing and enabling innovation through practitioner empowerment, practice development, and a number of other workplace characteristics, all of which are prerequisites to quality patient care. So although my early work was within nursing, over the past 20 years, I've been working in a multidisciplinary context with all the disciplines to help them understand how we achieve these sorts of cultures in our workplaces and our daily work. So the effective workplace culture concept analysis I mentioned looks a little bit dense here, but I'm going to unpick this. But just to help you find your way around that, the publication in 2011 identified on the left those enabling factors that fell into the individual enablers and the organizational enablers. In the middle, 5 essential attributes that would help you recognize an effective workplace culture, and on the right hand side how you would know you had one, and those can inform indicators which would help you evaluate whether cultures were effective in terms of both flourishing staff, absolutely essential now in terms of retaining our staff, because it's difficult to retain them and grow them, and also flourishing cultures because we know that provides quality and safe care to the people and the services that we provide. So that overview, I should come back and look in a little bit more depth. The first attribute in that effective culture was originally these 10 values, and this was all distilled from an analysis of the literature. And I know that nobody's going to be able to remember 10 values in their day-to-day work. So we therefore clustered them into 3 clusters. The first was person-centeredness. The second one was how we work with others, the SIP principles there: collaboration, inclusion, participation, open communication, high support, high challenge, the teamwork and the leadership development. And the third cluster, effective care, which was about evidence use and development, lifelong learning, positive attitude to change, and holistic view of safety. Then carrying on to the other 4 attributes, but this was really, really important to spell these values out. The other 4 attributes are presented on this slide. The second being a shared vision, values, direction realised in practice with individual and collective responsibility. And I think probably I'd emphasise more about a shared purpose now because it's more practical and can ensure that we have clarity in our roles, although vision is also important. The third attribute about being adaptable to enable innovation and creativity to maintain workplace effectiveness, because we work in contexts that are constantly changing. The fourth attribute being appropriate change is driven by the needs of patients, service users and communities. And I would use people now instead of patients, but this is going back over a decade when person-centeredness was not so prolific as it is now, and our understanding is much more developed now. And then the fifth attribute was having the formal systems in place to embed those values. And the formal systems that needed to be in place were those to enable continuous evaluation of effectiveness, learning, performance, and shared governance. So there was a collective focus on evaluation and a collective responsibility together to maintain effective working, all focused on action. So I'm moving on now to the insights that we developed from that safety culture project, because we found that actually, if you want to embed a safety culture as well, then you cannot do that without being person-centered. And so those 3 clusters of values we refined to show their interrelationship. They are all interrelated. But there were also 2 other insights that we discovered in the Embedding Safety Culture project. One was the importance of not being too theoretical with being person-centeredness. The original concept was person-centeredness, and what we need to see is people being person-centered, so they really live those values. So we've accentuated that. And then the other thing that's underlined in the effective care was the learning. So it wasn't enough to have lifelong learning. It needs to be much more active than that and appreciative. So we build on what we learn appreciatively and we celebrate that, and we include in the learning an inquiry approach. So that's how we modified our understanding of those values from that safety culture project. I'm just making sure everybody's okay. I can't see the chat, so I can't see if there's any challenges or problems. Is everything okay?
Things are going well.
Lots of thumbs up there.
Oh, good. That's okay. Thank you. So the other refinements were in the enabling factors. So the other refinements that we were able to identify in the safety culture project, the Squire project that's in red there, were modifications to the enablers. So the transformational leadership behaviours have continued to be really important for individual leadership behaviours. But of course, the emphasis has moved to much more to collective leadership now, but you have to start somewhere, and you need a transformational leader to begin that journey. So that was still the same. The things that modified was the skilled facilitation. So it was skilled facilitation that engages staff in co-creating meaning and shared purposes, as well as much more complexity at every level of the system. The role clarity again remained really important. Then some of the changes in the organizational enablers were also important to flag up from our insights. Okay. So the first organizational enabler was the need for collaborative and authentic senior leadership at the meso level. By that I mean the organizational level. And that needed to be supportive of our frontline teams, which we call microsystems, rather than top-down tirades of demands. The second enabling factor was the focus on supporting bottom-up change and emphasising the role of human resource departments and managers in recruiting for shared values rather than tokenism. And the third change was the need to embed values in organisational systems for learning, development and improvement based on appreciation of what works and growing organisational capacity and capability in leadership and facilitation. Absolutely essential if we want to create those effective workplace cultures. And what we found in the 4 big acute trusts that we looked at the safety culture on was that there were no governance systems that focused on learning and building on learning. So the view was you do this project, tick the box and on to the next project, rather than thinking about how we can build on our learning to improve our quality and safety, at building on that organisational memory and a capacity to learn. So the outcomes of effective workplace cultures, the indicators that we would know that we had an effective workplace culture, which we argued with Cheryl Moss and Jackie Chris, that effective workplace cultures are a proxy for achieving those health, quality and well-being outcomes, were that you would, if you walked into one, you would observe the values and experience them in action. You would see the indicators of high-performing teams, part of which is the consistent achievement of standards and goals, particularly if they're SMART goals. You can evaluate whether those have been achieved. Evidence-based practice, continuous learning, development, improvement and innovation, all of which are integrated with each other. Empowered and committed staff, which will be reflected in recruitment and retention indicators, and then everyone flourishing and that having an impact on the quality of the service. So I mentioned about the ACER initiative. This initiative is set up in the NHS trust that I worked with, which was a big acute NHS provider. And this ACER initiative resulted from running a multi-professional clinical leadership program that included all our professions, including medicine. And I underpinned this by practice development. So I didn't call it a practice development program because I wanted to engage as many people as possible, but all the principles were underpinned by practice development. And at the end of the 9-month program, the participants, not all of them embarked on this, but many of them did, on developing a portfolio of evidence to show that they first of all met that bullet point. We had a co-created a shared purpose framework for the organisation in terms of delivering person-centred, safe and effective care and effective workplace cultures. And people at the beginning were expected to develop a portfolio of evidence which demonstrated all those 4 purposes. But it was very onerous, and after a period of time of evaluating our experiences using this approach, we decided just to focus on the effective workplace culture, because that alone integrated all the other 3 purposes, and therefore it made it less onerous and reduced duplication, and more likely to be a goal that could be achieved by the teams. And then lastly, when we developed the guiding lights for effective workplace culture, we then reframed the initiative to focus on the guiding lights. Again, less onerous for the participants, easier to collect evidence around, focusing on what mattered to staff and what were the real essence of what effective workplace cultures look like. So 4 of the teams have published their learning and experiences in Duncan McKellar's chapter in the International Practice Development textbook, and just to share what those teams were about. They were from very different disciplines. So the nursing team was really interesting because the team leader had undertaken the leadership program in the very first tranche, but it took her about 5 years to get to the stage where she had a really influential team that was really person-centered. And she always remembered that what stayed with her was the high support, high challenge, which she tried to use. And she demonstrated with her team real collective leadership and person-centeredness. And they are the team that were always attending all the innovative events. Always tranches of staff were able to come. She was able to free them up to be involved, and they became key leaders in the organisation for many of the initiatives. And they also demonstrated the person-centered initiatives of enabling people to get married on the ward when they might be dying, and so on. The second team was led by a speech and language therapist, and that her key enabler was again collaboration, by enabling everyone to be involved in collating the evidence that their workplace team had an effective culture. And she was then very influential as a leader across the organisation. The third team was a medical team. It involved a children's psychiatrist and children's ENT consultant and another consultant, and they worked together. Now originally they thought they could only work on the person-centered aspect, so they used emotional touch points to with staff as well as service users to focus on what matters, and that was transformational for them as people as well as their team, and they were able to demonstrate a real impact on their service in becoming more person-centered with their staff and colleagues as well as their service users and the children and families they worked with. And then the last team, a microbiology team, had a previous challenging history around poor leadership and management and fragmentation. And this team again was very successful because the team leader enabled her team leaders and staff to be collective leaders in enabling that compilation of the portfolio evidence to demonstrate that they were effective leaders. All of these teams then were profiled and recognised for their awards by the chief executive team and senior executive leaders in the trust. So that tells you a little bit about that. Now moving on now to trying to make sense of all that background informed the guiding lights work, and we used the word guiding lights for the final version that has been published because we wanted to build on another idea called simple rules, but we didn't like the concept of simple rules because it was a bit mechanistic and not really in tune with the intuitive holistic approaches of practice development. So the simple rules language came from a very influential realist review of large-scale transformation in Canada by Best et al. And they did a literature review using a research approach called research evaluation. Now, realist evaluation focuses on these three things in the orange boxes. The first, it will always ask the question, what works for whom, in what context and why? And it recognizes the complexity of the context in which we work. And so what works in one context will not necessarily be the same in another context, but there may be a number that are shared. And then you focus on understanding what is it in the context that is influential, what are the readiness factors, if you like, and you combine these with the mechanisms. So what are the triggers? What is it? What is the why that enables the context to achieve the outcome when it's combined with these triggers? And then this type of research also identifies program theory, which is then refined. So even if you don't understand what I've said, those who are interested in this may find it useful. So basically, this big study identified some simple rules to explain how you go about large-scale transformation. And these simple rules we were influenced by in the Guiding Lights for Leadership project, which was a Burdett study, which I mentioned, looking at how to strengthen nursing, midwifery, and AHP leadership in all contexts. And these, we used the word guiding lights there because we thought it was more reflective of the sorts of practice realities and contexts that we work in. So it's not set in stone, they are guiding lights. So the actual term simple rules, just to get a sense of that, was about the broad principles of change for which interpretive flexibility would be needed in different contexts. So you can see the role of the context has previously been underestimated. Contexts are really influential in how we take forward our workplace cultures, as well as the mechanisms that we use to ensure that they are effective. So the Guiding Lights for Leadership, where we used the term first, was focused across the UK in all 4 countries, in all contexts. So that was practice, education, research and strategy. And we generated these 5 guiding lights, which focuses on relationships aspects of leadership, which the first one being about the light between us as interactions in our relationships, the second about seeing people's inner light, the third about kindling the spark of light and keeping it glowing, the fourth about lighting up the known and yet to be known, because so much comes left field and we need to model our calmness and stability and our values when this happens and enable others to see how we manage these things coming left field in a calm way. And lastly, the constellations of connected stars, because we can no longer, if you like, we no longer can be experts in everything. We can only work with others to ensure that we complement each other. I'm just checking the time about where we are, so it's 3 o'clock. Okay, so in terms of the research design, we had 3 phases. A website we set up to share effective workplace culture and a number of blogs. We used a Twitter chat and analysed that. We generated tentative hypothesis and what CMOs, that's context mechanism outcome statements. We then shared that in a big workshop at the Basel conference 4 years ago now, the Practice Development Enhancing Conference, to generate 4 guiding lights for effective workplace culture. We then followed that up with a Twitter chat to refine our insights and understanding about the 4 guiding lights. This gives you an example about how we manage the data at various more sophisticated level of analysis. So all the C's are context, all the M's are mechanisms, and all the O's are outcomes. It just shows you how we work with the data in a one-off slide. It was much more complicated than that, and there was a lot of going and back and forth with all my colleagues to refine the work. So the actual 4 guiding lights, what they are. The guiding lights then, the first one is collective leadership, second living shared values, the third safe critical creative learning environments, and the fourth change for good, that makes a difference. And I'm just going to explore a bit more detail about each of these. So collective leadership, we've got a tweet there that informed what this was about, so I can let you read that. But on the right hand side, we have what is a simple program theory about collective leadership that has in it highlighted the context, the mechanisms, and the outcome. But on the next slide, this is broken down a little bit more detail, so I'm going to go on to that next. So here you have what the context and mechanisms are for collective leadership. So in contexts that support and develop visible, authentic, credible relationship and collective leadership, combined with leaders who are able to use these mechanisms in their work and everyday practice, then you will achieve these outcomes for staff. So staff feel valued, they feel respected, they have a sense of mutual shared understanding, they are empowered to speak out and lead. So I will have to enable you to review these in more detail outside of the session, but you get a sense of what this is about. The second guiding light, living shared values, and it's very much about the values that we talked about at the beginning of the masterclass. And then the tweet that values, in my opinion, should be owned, shared and nurtured, the permission to be authentic, that came from one of the original data sources. And here again, using the same format for living shared values, you can see the characteristics of the context that have to be in place to start with, whatever that context is, and the sorts of mechanisms that are used within teams, that are caring teams, to combine with the context to achieve those outcomes. First, you see what those outcomes are in staff, and then you see what the outcomes are in patients. I should say that these are intermediate outcomes. They're not the final outcomes that arise from all of the 4 guiding lights. Then moving on to the third one, safe, critical, creative learning environments. An effective workplace culture will feel safe to be courageous with ideas, safe to notice and highlight what is working well. So psychological safety is a key enabler. So here you see what the context has to be like to enable this to achieve those intermediate outcomes. You can see what people need to do, what the mechanisms are to combine with those contexts to achieve those intermediate outcomes for staff, to build on what works well, to focus on solutions, not blame, and that for service users to feel that the environment is safe and that their feedback is valued and will be used to inform what works and what can be improved. And then the last guiding light here, from one of the Twitter chats, you matter and I care is an interaction that takes a couple of seconds. That's all it takes in our busy lives. And so here, in context that focuses on what matters to people, whether that's staff, patients, service users, students, and change for good, that focuses on what matters. It's about having that collective purpose, monitoring those external influences, through horizon scanning and so on, and navigating complexity. And the mechanisms here, what staff need to be able to do and what leaders need to encourage is to care for people with compassion, to actively seek feedback from different groups, to use positivity to enable innovation, and to work with different sources of knowledge to generate evidence both from and in practice, and really understand what it is that energizes people and know what that will make a difference. And then the intermediate outcomes there you will see for staff, and then feeds into the effective service delivery and the impact on the organization. So all of those intermediate outcomes are combined together so that all 4 of the guiding lights are needed to achieve those ultimate outcomes in practice. And those ultimate outcomes impact upon partnerships and relationships outside of the workplace as well as within. So that tweet there, I strongly believe the 4 pillars, the 4 guiding lights should be reviewed as threads that weave together to inform and strengthen each other. They are not separate entities. So I'm coming to the end now, but I'd like to emphasize this concept of microsystems, because really practice development has led the way on understanding microsystems culture. And when I undertook my research, it was before the Crossing the Chasm work in the Institute of Medicine in Minnesota that focused on the importance of complex adaptive systems to understand complexity in healthcare, and that the microsystems was the level that we needed to really support, because it's a microsystems where our frontline teams provide most healthcare to most people. They are the essential building blocks of large organizations. They are the place where patients and providers meet, and the quality and value of care produced by any large health system and organization can be no better than the services generated by the small systems of which it is composed. That's why effective workplace cultures are so important. And my final slide really is, in the Squire project, we were able to establish that effective workplace cultures that are person-centered, safe and effective at the microsystems level requires quality clinical leadership within those frontline teams. That is absolutely key to effective workplace cultures. And at the meso level, which is organizational level, we need to grow facilitators to support frontline teams, to break down the silos between learning and development, improvement, research and innovation, to support transformation. And our leaders need to be enabling supportive leaders in our organizations. So, questions, comments, and discussion. We might have 5 minutes. The references are here for you to follow up if you're interested. And you can always contact me through Susie or Barb if there's anything that's unclear you want to follow up outside of the session. So thank you for listening. And hopefully now we do have maybe 5 minutes, 6 minutes.
Thanks so much, Kim. We have 5 minutes. So as Kim said, we can use the chat box or even unmute yourselves and speak, can't we, Kim?
Yes, we can.
Yeah.
We can. And
to ask any questions.
Try and stop sharing so I can see people, which is good.
So there's a question there for you. The role of the facilitator. What sort of training is enough, would you feel, Kim?
Well, we've all done a lot of work on facilitation standards and what that looks like. And I think the core values that we hold as a holistic facilitator is absolutely key. So within our practice development world, we're talking about holistic facilitators rather than project managers. That approach to facilitation is not going to enable us to get embedded, co-created change. So there are levels of complexity, and we have to start somewhere, and using the workplace as a really vital resource for facilitating an integrated approach to learning, development, improvement, inquiry, knowledge translation, innovation is absolutely vital. So we need to grow our facilitators to do those things. And many of our educators have some of those skills, but we don't use our educators in an integrated way to join up all the agendas. So I know within Australia, there are many opportunities to do schools around facilitation, advanced facilitation, and the facilitation skill set is also needed for our leaders, our clinical leaders as well. I know we can talk about that more outside if that.
Yeah. And I think, Kim, that is definitely what we have seen. And as you know, we are now here at Southeastern Sydney, a member of IPDC, and we ran our first foundational school. And the amount of people that have enrolled, not only from our district, but from the Illawarra and from across the state, was outstanding. So I think people are starting to realise, you know, how important that is for everybody, from, you know, from your frontline clinical staff to your executive leaders, to be able to facilitate. And it is such an important skill, and it's something that we really need to continue to work at and provide those opportunities. And
I think, as you say, you know, we're recognizing it in our leadership development, the need for that skill facilitation in like effective leadership program, for example, but and we're offering facilitation development. Well, we're doing a lot, Kim, but I think it'll be really nice to align it beautifully to those guiding lights. And the
also
culture framework.
In the UK, it's also embedded in our consultant practitioners. So our consultant practitioners are expected to have the skills of systems leaders and also embedded researchers across the system. So facilitation is key as well for those.
That's right.
Any others at all? Any other questions? Let's see, I could just see the wrong.
Just put the slide up there for somebody, and I'm just going to put an evaluation slide up. Is that on the screen?
It is, Susie. I'm just wondering, sorry, Susie, just because this was such a great presentation, Kim, and I'm just going to ask the audience, what we would like to do is be able to share it with you. So I don't know the best way to do that because we haven't actually, as a organisational group, decided where we're going to actually put these recordings. So if I can ask you if you would like to be sent this slide presentation from Kim, if you could just put your email address in the chat box, that might be our best way this time to get the presentation out to everybody.
Because what happens on Zoom actually is those that have come in through an email will have your email account, but sometimes you're coming in just as a number. Yeah.
Perfect. And there's lots of people putting their email addresses in, so thank you for that.
And we could send it out again, Kim, if you are happy to, with a PDF it and send it to the distribution list. The slides and then the recordings we'll be putting in our district, hopefully on the intranet somewhere. Yeah,
absolutely. Please do anything that can help with it. Thank you.
Great. So any more questions for Kim?
Somebody's asked, Andrew's asked, is that our realist evaluation skills being taught, developed at the ward team level? Well, I suppose if you were engaged in any research skills as an embedded researcher, then those skills will be important to develop. And you might need to look to your university colleagues to see what opportunities are for joint appointments to develop these sorts of skills. There's increasing much better liaison between universities and practice to really deliver on these sorts of agendas. I don't know. I know that there is a wish to do that in Australia and certainly in where we are in Wollongong.
Yeah, good question.
I'm just seeing if there's any.
Lots of thank yous there, Kim. So we have just got one or two questions on that QR code there to evaluate, which would be really nice if we could get your feedback and ideas for the next masterclass. And just so you know, the masterclass, we thought it might be important to say it's no sequence to it. So when you can get on, come on. And if you do miss it, we'll get the recordings to you somehow, eventually, through the intranet.
I don't know, we use YouTube. We've got a YouTube channel
I was
now.
thinking
that seems to work quite well, but I don't know how to do it technologically.
No, I think that might be something that we might be able to perhaps consider, Kim, if you know, presenters are happy. It's an easy way to go. Yeah. There's a few coming to the conference there.
Yes, look forward to connecting with everybody tomorrow. That would be great. Bit nervous about there is a little bit of overlap with this presentation, not much.
Well, it'll be wonderful. Yeah. Well, that's us at 1:15. So well, thank you again so much, Kim.
Just got one last question, if that's okay, Susie.
Where's that?
From Justin. Kim, do you think we should work on getting these practices embedded in the training courses for health professionals?
Yes, I do. And I think it should be right in from the very beginning.
Yes.
As soon as people enter their education programs at every level. And if you take facilitation, for example, to facilitate complexity at systems level requires a lot of skills. So you've got to start somewhere. We are facilitating patients and people to learn about their health, so we can build it into that sort of continuum. So yes, definitely.
Yeah.
Wonderful.
Great. Thank you all.
Thank you, Kim, again so much.
Thank you. See you all tomorrow, or some of you tomorrow, and
yes,
some of you another time.
Thank you. Thanks so much. Thanks.